The USAID Uganda social marketing activity was awarded in November 2015. The social marketing activity is an overarching 4-year project supported by USAID to reduce new HIV infections, total fertility, maternal and child mortality, malnutrition, and mortality due to malaria amongst women and men in Uganda. The aim of social marketing activity is to increase access to family planning, HIV, maternal and child health, nutrition, and malaria services using the total market approach. The social marketing activity is delivering a core package that combines evidence-based approaches addressing the barriers that directly and indirectly increase people's risk to disease. The 3 objectives of the social marketing activity are to increase access to quality and affordable health products and services, to increase the demand of socially marketed health products and services, and to strengthen health systems for sustained and equitable access to health products and services. The social marketing activity is being implemented by Uganda Health Marketing Group (UHMG) as the prime partner, working with the Ministry of Health, civil society organizations, and the Good Life Clinics franchise. The project is being implemented in 100 USAID scale-up districts, including the 19 USAID District Operation Plan districts that have high HIV prevalence, high fertility, and high unmet need, low condom use, burden of malaria, and poor nutrition indicators. Over the 2 program years, the social marketing activity has achieved a number of milestones. The project has expanded distribution channels and has created more opportunities to reach the end user. Among the channels created were the establishment of 50 one-stop shops, the identification and branding of 273 franchise facilities referred to as Good Life Clinics. Partnerships were developed with 2 medical bureaus. 100 district-based distributors were established. 1,746 social entrepreneurs all across the country were empowered, and 100 drug shops all across the country were identified and supported. Over the 2 years of project implementation and through these channels, the project has distributed over 20 million protector condoms, over 2.7 million O condoms, approximately 5 million Pill Plan Plus doses, and over 5.4 million Injector Plan doses.
Okay, family planning, as you can see, it has given me space. My boy is studying now, and I do my little business. And our budget is now going on well. I can even afford his school fees because I'm saving.
The project has also strengthened the provision of integrated health services through existing social franchise networks and for-profit providers. Over the 2 years of implementation, the project has served over 165,000 children aged below 5 and in excess of 10,000 pregnant women with nutrition assessment and referrals, served over 25,000 children with DPT-3 before the age of 12 months, integrated capacity building initiatives for 275 Good Life clinics, oriented 205 Good Life promoters, introduced and launched the maternal voucher scheme in 10 facilities, oriented and trained approximately 1,200 health workers on nutrition assessment, family planning, service quality improvement, malaria, the voucher scheme, and data management and utilization. The project has served over 360,000 people with family planning services. It has served 45,274 new family planning acceptors. It contributed over 1.9 million couples' years of protection and conducted regular support supervision visits.
Kinyambye bulungi kubanga ozaala omwana n'omuwa space ogenda omuzaako munne nga asobola okwekolera ekintu kye. Sigamba nti ozadde ate mwaka gumu ate ozadde n'akato tolina nkwata gy'osobola abakwatamu nti ositule ono ate ono omuweeke oba omuwaze space asobola ositula mwana munne mubaako bamugenze mu ddwaliro bamugenze mu nnimiro.
Over the 2 years, the project has used several approaches to increase demand for socially marketed products. The project has employed the use of a 360-degree approach in order to reach the different segments of the market. Through sponsorships, branding, brand promotions, and workplace activations, the project has reached the intended audiences in all corners of Uganda. The project has specifically achieved the following. It has held a very successful netball tournament of 48 teams across the country that attracted over 65,000 spectators with Injectaplan and other socially marketed products. The project reached 6,446 women through 120 hospital and workplace activations. It reached 16,672 people through 538 bar and video hall activations. The project reached 4,705 people through school activations. It also branded 445 taxis and 200 walls all across the country. It reached approximately 45,000 people through brand sponsorships, partnerships, and music.
UHMG!
The project saw up to 574 radio spots being aired. It also developed an integrated family planning campaign dubbed I Was Wrong. And the project has also embraced the use of social media and reached over 1.4 million Facebook and Twitter users, creating over 3.5 million impressions. Under the Strengthened Systems for Sustained Equitable Access to Health Product and Services result area, the social marketing activity has accomplished several milestones, and these include developing the Total Market Approach (TMA) strategy, developing partnerships with 5 community-based organizations, upgrading the online database system, and getting linked to the USAID Uganda Performance Reporting System for reporting on a quarterly and annual basis. Through the research arm, it has conducted 2 surveys and 1 rapid assessment. And key milestones and success stories have been captured and shared widely through papers, the biannual newspaper, and social media.